Did you know that colon cancer is the third most common cancer worldwide and the second leading cause of cancer-related deaths? Every year, millions of people are diagnosed, often too late. But what if we could change that? What if you could recognize the causes, reduce your risks, and understand the latest treatments available? Stay with us as we dive deep into the science of intestinal and colon cancer. What causes it, how we can prevent it, and the cutting-edge treatments saving lives today. First, let's break down the basics. The intestines and colon are key players in digestion, absorbing nutrients and expelling waste. But when cells in these regions begin to grow uncontrollably, tumors can form, leading to what we call colorectal cancer. This type of cancer usually starts as small clumps of non-cancerous cells called polyps, which can turn malignant over time. So what exactly causes these cells to mutate? Scientists point to a mix of genetic and environmental factors. Here are the key contributors. Genetics. About 5 to 10% of colorectal cancer cases are hereditary. If a close family member has had it, your risk significantly increases. Conditions like Lynch syndrome or familial adenomatous polyposis heighten your risk. A diet high in red and processed meats, low in fiber, and rich in unhealthy fats has been strongly linked to increased intestinal cancer risk. Research suggests that gut inflammation caused by poor diet can fuel carcinogenesis. Lifestyle factors. Sedentary behavior, smoking, excessive alcohol consumption, and obesity increase the risk of developing intestinal cancer. A 2018 study in the Journal of the National Cancer Institute found that prolonged physical inactivity leads to increased inflammation and insulin resistance, both linked to cancer development. Inflammatory bowel diseases like Crohn's disease and ulcerative colitis also elevate the risk due to prolonged inflammation in the gut lining. Detecting cancer early can mean the difference between life and death. Be on the lookout for these warning signs: persistent changes in bowel habits like diarrhea or constipation, blood in the stool or rectal bleeding, unexplained weight loss and fatigue, abdominal pain or cramping that doesn't go away, and a feeling that your bowel doesn't empty completely. The best way to catch colon cancer early is through regular screening. The gold standard is colonoscopy, recommended for those over 45 or earlier for high-risk individuals. Other options include stool-based tests like FIT, which is the fecal immunochemical test, and Cologuard. If cancer is suspected, doctors may use imaging scans and biopsies to confirm the diagnosis. Before we talk about treatment, please take a moment to subscribe to our channel for regular health updates. Now let's dive into the treatment options. If diagnosed early, colorectal cancer is highly treatable. Here are the most effective options. Surgery is the primary treatment for localized tumors, and minimally invasive laparoscopic surgery is now common, reducing recovery time. Radiation therapy is often used before surgery to shrink tumors or after surgery to kill remaining cancer cells. Chemotherapy involves drugs like 5-FU, which is fluorouracil, and capecitabine to target rapidly dividing cancer cells. Targeted therapy focuses on blocking specific molecules that help cancer grow. For example, EGFR inhibitors like cetuximab are used in some cases. For patients with advanced or genetic-related colorectal cancer, immune checkpoint inhibitors like pembrolizumab are showing promising results. Prevention is always better than cure. Here's how you can lower your risk. Eat a fiber-rich diet with plenty of vegetables, fruits, and whole grains. Reduce red and processed meat intake. Exercise regularly, at least 30 minutes a day. Avoid smoking and limit alcohol consumption. Stay proactive about screening, especially if you have a family history. Intestinal and colon cancer might be a formidable challenge, but with the right knowledge, early detection, and evolving treatments, survival rates are improving. The key is awareness and action. If you found this video valuable, share it with your loved ones. And if you're due for a screening, don't delay. It could save your life. Thanks for watching. We will see you in the next video.